Hello, I'm Julia Court, co-executive producer of Nova. On behalf of my co-EP Chris Schmidt and myself, welcome, and thank you so much for joining us for this special conversation. At Nova, we're committed to exploring the science that impacts all our lives, and that's why we're so excited to bring you the Cannabis Question, available to stream on the PBS video app and on Nova's YouTube channel. We wanted to make this film because although millions of Americans are now using cannabis, and pretty much everyone has an opinion about it, we realize that a lot of us don't necessarily know what science has learned about this plant and how it affects us. And as we researched this film and found out more, we discovered how complicated the story of cannabis really is. A lot of you have heard of THC and CBD, but as the film reveals, these are just two of the dozens of compounds in the cannabis plant that interact with a key system in our bodies. We learn that while there's a multi-billion-dollar industry marketing cannabis to consumers, there's only one cannabis-derived drug that has been approved by the FDA. And at the same time, the criminalization of cannabis continues to have a devastating impact, especially on communities of color. As Americans are trying to make decisions about what kinds of policies we want around cannabis in our communities and in the country, and in some cases, whether and how we want to use cannabis products, it's so important that we all have reliable, accurate information about this plant, what its potential benefits are, and its risks. We're so grateful to PBS, the Corporation for Public Broadcasting, the Nova Science Trust, which is a group of individual donors who generously support our mission, and the George D. Smith Fund for making this film and conversations like this one possible. I also want to extend a special thank you to Liz Ebel-Neuweiser and Mary Cardona Foster at GBH, and to Maggie Stevenson, Jennifer Welsh, and Gina Veramo at Nova for all their work organizing this event. And now I'd like to introduce Dan Adams, cannabis reporter at the Boston Globe, who'll be our moderator for this evening's conversation.
Much, Julia. I'm really honored to be joining you and the Nova team this evening for what I believe will be a very timely conversation about a subject that, as you said, generates a lot of rhetoric, but is rarely discussed with much nuance. And in fact, one of the things I like best about the cannabis question is that it embraces that nuance. It explores the inherent complexity of cannabis instead of trying to just reduce it to a simplistic caricature. And all of us in the media, we have a duty to tell the truth, even and especially when it's complicated. It's really important that we do that because, for better or worse, in the media, we set the narrative. We choose which facts to highlight. We choose stories, voices cast. We choose which questions they answer. We choose the framing. We choose which opinions are ultimately acceptable. And those choices change how people think, which is a big responsibility. And unfortunately, if you look back at the history of cannabis journalism, which I did when I started reporting on the subject in 2016, you'll find that a lot of it really falls short of that responsibility to unfurl a complex truth in its fullness. And that's why reporting like the kind included in this film, in the Cannabis Question, is so critically important now. This film includes marginalized voices that have been excluded in the past, and it looks past those sort of old and outdated and incomplete narratives. And at the same time, it looks ahead to the state of the science and how cannabis actually affects us instead of some of the misinformation that was propagated in the past. And so it really, by doing that, invites us to move beyond those sort of stale yes or no shouting matches of yesterday and move on to the how, the who, the important stuff with a lot more context under our feet. And so for the rest of our session, we're going to accept that invitation. We're going to try to continue that conversation. And we've got a panel for you that is really just overflowing with expertise and that kind of nuance that is needed when we address this subject. So really excited to get into that. But before I introduce them, I just wanted to tell you about two very brief housekeeping things. The first is that we're going to be taking written questions throughout this conversation. We're really eager to hear from you. So you can do that by clicking the Q&A tab in the bottom corner of your screen. type the question and submit it. Just please keep those brief and focused so that our panelists can get to that information you're looking for and get to as many questions as possible. The other thing I want to let you know is that this event is being live captioned. You can turn on closed captions by clicking the live transcript button on the bottom. And by the way, that is a really cool accessibility technology. It was pioneered right here in Boston at GBH and helps a lot of people. So with that, I'd like to introduce our panel. First, we have Sarah Holt. She is the veteran writer, producer, and director behind The Cannabis Question. She's produced more than 30 hours of broadcast television, including the excellent 2018 film Addiction, which, like this film, The Cannabis Question, set out to correct inaccurate narratives about substance use disorder and looked forward to the future of harm reduction. Second, I'd like to introduce Dr. Yasmin Hurd, the director of the Addiction Institute within the Mount Sinai Behavioral Health System, as well as the Ward Coleman Chair of Translational Neuroscience and Professor of Psychiatry and Neuroscience at the Icahn School of Medicine at Mount Sinai in New York. She is an internationally renowned neuroscientist, and her work on the neurobiology of drug abuse related to psychiatric disorders has really shaped that field in the field of addiction medicine. So we're really pleased to have her tonight. Next on our panel, we have Kassandra Frederique. She is the executive director of the Drug Policy Alliance, and she's one of the country's top experts on the real nuts and bolts of marijuana regulation. So just ask any congressperson that she's talked to about that, and they'll vouch for her. She's also a leading voice calling for equity over profits as we ponder ending the war on drugs, which, as we learn in the film, has disproportionately harmed Black, Latinx, Indigenous, immigrant, and LGBTQ communities. And finally, but certainly not least, we have Dr. Catherine Jacobson. She shares her story in this film, which you'll know if you've already seen it. So she earned her PhD in neuroscience from Oregon Health and Science University. And after her son was diagnosed with intractable epilepsy, she dedicated her professional life to finding new treatments for children with severe epilepsy. And her work actually helped lead to the FDA approving CBD as an anti-seizure drug back in 2018. So before we begin our conversation with this great panel we've got for you, we are going to just take a quick look at the trailer for Nova's The Cannabis Question.
I loved how calming it was. I'd have the best night of sleep that I've ever had in my life. And I said, this is amazing.
1 in 7 adults in the United States are using CBD. You see CBD everywhere.
The job creates a need for pain relief. Cannabis allowed me to eliminate all pharmaceutical drugs.
Watching your child have a seizure is really, really scary. It's awful, right? It's awful because you know that brain damage is happening. The kids get scared, they get confused.
My son had a devastating form of epilepsy, and a cannabis compound gave him a life.
People believe it can cure any disease that exists, or it's going to cause the downfall of society.
Someone gets arrested for cannabis every 58 seconds. Cannabis is one of the driving forces fueling mass incarceration in this country, disproportionately targeting poor people and communities of color.
He asked me about any weed being in the vehicle, and I told him, sir, you know, I'm a medical cannabis patient from Arizona. I give him my IDs, and he said, well, you won't need these where you're going.
This moment is about building new responses to drugs that are based in science and that are based in the rights of people.
Cannabis opened the window into the functioning of our body.
One of the most amazing things that happened was the discovery of the endocannabinoid system.
THC binds to receptors in the brain and outside the brain. And when it does so, when it binds to these receptors, the cells now behave differently.
The cannabinoid receptor is the most abundant receptor in the brain. We need to really understand what these drugs do to the brain. Dose matters. When you take it during development matters.
The plant is comprised of over 400 compounds, 400.
We have frighteningly little data on the long-term effects of medical cannabis use.
We're talking about long-term treatment.
If someone were to tell me that I was dependent on marijuana, I would have said, no way, absolutely not.
For what conditions is it beneficial, and for what conditions is it harmful? It's not black and white, and it's complicated.
What does the data tell us? What does the science tell us? Truth through science. We should know the answers.
Great. Welcome back to the panel, everyone. Sarah, I'd like to start with you. So, as I know from reporting on it myself, cannabis is just one of those subjects where people can be really tangled up in preconceived notions, right? And so I'm wondering if that affected a little bit the way that you made this film, knowing that the people watching it might need to be disabused of some outdated information, or that you might be reframing issues for them in a way they hadn't thought about before. So the question, I guess, is, did you feel you sort of needed to pick up where our assumptions left off, and how far was it from there to the truth?
Well, my heart sank when I started off researching the film because there are hundreds of films on cannabis. And I could see people would think, oh, it can cure cancer and it can cure this and it can cure that. And other people talking about how, it was, damaging the teenage brain or leading to addiction. And, I think for me, the first realization that I had was, one, cannabis is complex. It's not one thing. It's 500 chemical compounds. It really depends on when you use it, whether your brain is developing, whether you're an adult, if you use it infrequently, if you use it every day. It depends on the dose you use. So I began to realize it's just the plant is complicated and cannabis is complicated. And so the film really does quite a journey through, the labs of the leading cannabis scientists, to patients and families that are using cannabis, then to, Kassandra and other experts that have spent a long time looking at the negative impact of the criminalization of the plant. And I think it held together, but there were times where I wondered if it would.
Well, as we discussed a little earlier in this evening before the audience joined us, all of us on the panel are firmly convinced that you pulled it off. So our hats off to you. Dr. Hurd, I actually wanted to go over to you if I could. Sarah just mentioned that really the biggest thing she found, is the complexity, is the nuance, right? And that this was a subject that is not easily boiled down. It's not easily condensed. That makes me think about science and designing experiments. It must be difficult to sort of ask a precise enough question when you are studying a plant that has, as we just heard, so many different compounds doing so many different things in it. So I just wondered if you could talk a little bit about your approach to cannabis research and how you start to peel apart that complexity so that we end up with a more full picture of the plant than just a sort of frag looking at one thing or the other.
Absolutely. What Sarah said completely resonates with the science of cannabis. So for me, I was interested in understanding what was the vulnerability to substance use disorders that we saw in adults. And we looked at, genetics and early life events. And one of the things that you do see very often is that people do start with cannabis and other, drugs that are legal, like alcohol and cigarettes. But when we looked at it in our animal models, we can start to look at the individual components of the cannabis plant. And most preclinical researchers would look at THC, that cannabinoid which is associated with the high, and which, the psychoactive, you could say the most pronounced psychoactive cannabinoid. But it became more complicated as we started looking at the developmental effects of THC in our studies. We start to ask the question, we're studying THC and not cannabis. What if we study another cannabinoid? And so that's when we started studying CBD. And it was definitely different to what we saw with when we studied THC, where THC would invariably increase, for example, heroin self-administration, opioid sensitivity in our animal models. But CBD did the opposite, really. It was decreasing heroin-seeking behavior in our animal models, and then we started to move that to human studies. But that was the complexity. And even working with CBD as a researcher and for other investigators working with cannabis, there's a lot of hurdles, administrative, governmental regulations to jump over in order to study a plant that people could buy on the street, and we couldn't get it for our research. So it definitely was complicated.
Right, and we're still just talking about two of those 200 cannabinoids and terpenes, and even that, as you said, is very complex. I'm wondering. We have a question from the audience that's actually got something to do with what we're discussing right now, and I think that it would be helpful for our audience to take a step back and do a little definitional conversation here, clear things up, because this can get confusing with a lot of three-letter acronyms very quickly here when we start talking about cannabinoids. So, Dr. Jacobson, do you think you could help light the way through the fog a little bit here? Could you just sort of walk us through what's the difference between THC and CBD? And someone in the audience is wondering, is CBD from hemp the same as the CBD from the marijuana plant? And I'm sure that all of us, and I know I do. I see it in my grocery store. I see CBD soda. We're all seeing these CBD products sort of everywhere. So help us understand a little bit like what we're actually looking at here, the difference between these two compounds.
Right. So THC and CBD are both cannabinoids, but they have very, very different effects in the body. As Dr. Hurd pointed out, THC is the compound that creates the high. CBD does not do that. CBD derived from hemp is exactly the same molecule as CBD that comes from the cannabis plant. So when we talk about CBD, we're talking about a single molecule that has a structure that is well defined. And so CBD from any source is CBD. I would say that the confusion comes when you see something labeled as CBD in a gas station or a dispensary. It's not always CBD only, because those are almost always whole plant extracts, whether it's a cannabis extract or a hemp extract. It contains all the other cannabinoids and terpenes that are in the plant. And often, because of a lack of federal regulation, often those CBD oils also contain some small amount of THC. So it can be very confusing to the consumer to distinguish between different CBD oils because they're marketed. There's really very little regulation in how they're marketed.
I've definitely noticed that, and we've got a real tangle going on here in Massachusetts, where local hemp farmers are not able to sell edible CBD, but you go into any gas station, any supermarket, and you'll see those CBD products there nonetheless. So thank you, Dr. Jacobson, for helping to clear that up and helping us understand that a little better. I've actually got another great audience question here, so I would like to keep going with these. Someone is wondering, how close are we 1, and we should probably define that. That is basically the federal government's category in which they place the drugs that are supposedly the most dangerous, have the most potential for abuse, and the least therapeutic potential. I think many people take issue with cannabis being in that category. Kassandra, you've really got your finger on the pulse of federal policy. What is the landscape right now on Capitol Hill?
So cannabis
I'm sorry. Actually, I'm just being told here my connection may have dropped for a moment, and I apologize for that. So let me just briefly, in case you missed it, just for the audience, repeat the question. I'm just wondering what the political situation is in DC right now. Someone is wondering, how close are we to rescheduling, cannabis out of that category of the most dangerous drugs?
So, what I would offer is that there are so many different cannabis conversations happening in the federal government at this time. There are folks talking about banking. There are folks talking about the criminal justice aspects. The conversation around descheduling is on everyone's mind. However, there's no bill currently that folks are really engaging with that is solely focused on descheduling. Descheduling is coupled with coupled with more comprehensive reform. And folks are really trying to figure out how do we make sure that when we bring cannabis to the forefront, that we do it in a way that deals with as many issues as possible, because everyone knows how hard it is to move through federal legislation. The MORE Act, which is one of the most comprehensive pieces of legislation in the federal government, passed the House last year, but it didn't pass the Senate. And so this year it just passed the Judiciary Committee and is waiting, but we don't have the same confidence that it will pass in the Senate. So right now we're still waiting, but there's a lot of education that's happening, and people are looking for descheduling as a piece of comprehensive cannabis reform.
Thanks for that update. And of course, hanging over the whole situation in Congress is President Joe Biden. Unlike some of the other Democrats in the 2020 race, he ran on a platform of decriminalize but don't legalize, don't have licensed commercial sales. And so I'm really interested to see what happens even if Congress manages to pass something. Well, what happens when it goes to the White House? That's just as much of a question mark. So I think you and I are probably wondering the same thing as our viewer here. I just actually wanted to go back to you for one more thing while we're on this. Talking about federal legislation, we heard in the trailer, this idea of just how racially disproportionate the enforcement of drug laws was and has been and still is, for decades. So how does that get then baked into, what in your opinion at least would be a good federal legalization bill? How do we write a law that recognizes those disparities in the past? Is there any way to even begin making up for that? How do you go about thinking about that? It's such a complex thing.
I think the idea of how we navigate structural racism in policy is one that folks are always scratching their heads with. I think when it comes to cannabis, there are certain benchmarks that advocates are looking at. One is removing all the criminal penalties associated with cannabis. I think the other thing that folks are also looking at is how do we make sure there are viable pathways for people to be a part of the industry that has been set. And I think folks are also talking about the ways of limiting the role that other industries that have played exploitative roles in communities of color, be it alcohol or tobacco, and limiting the way that they can participate in the government, participate in regulation, considering the ways that they've exploited and only exacerbated health disparities in communities disproportionately over-incarcerated and who also lack access to broad-based healthcare. And I think there's also the conversation about how do we repair the harms. So there are a multitude of harms that cannabis prohibition has done, either through deportation, through the removing children from their families, people getting kicked out of schools, people losing access to their jobs, and people losing their livelihood due to incarceration. And so there's a conversation happening about what do federal level drug war reparations actually look like? These are all huge questions and all things that will not be answered at once. But I think those are some of the things that folks are looking at and figuring out how do we disincentivize policing around cannabis. Oftentimes, drug war funding is what creates really large law enforcement budgets, and these are things that are disproportionately impacted on communities of color. So really just looking at how do we really deal with the criminal legal issues, the issues of the industry, but also what version of reparation and repair can happen to communities of color. And I think that's happening on the conversation of the legal regulation of cannabis, but also when it comes to medical cannabis as well, right? And making sure that everyone has access to broad-based healthcare, including that of healthcare or pain management that's associated with cannabis.
Thank you. And thank you for complicating that for us. I actually appreciate that. I think you've led us to a better place, even though it is more complicated. I think it's so vital. We were talking a little bit about this amongst ourselves earlier. It's so we should be getting beyond the sort of the whether and onto the how and the who. And that's where our values, I think, will really come to bear on cannabis policy. I'd love to see the public get more engaged in that. So thank you for inviting them into that really important conversation. I want to just turn it, if I could, back to the science side of things just for a moment, because we definitely have a lot of people who are interested in that. Circling back to CBD, are there any side effects? Are there things that people need to be worried about? That's something that someone in our audience was wondering about. Dr. Jacobson and Dr. Hurd, I know you're both well qualified to let us know about that.
So I'll just speak to the artisanal preparations. The problem, so CBD itself is very benign, and at the doses that are present in the artisanal preparations that you get at the dispensaries or the gas station or the corner store, they're really there's a low likelihood that they will be harmful because of the CBD. But the real danger of these preparations is that they're not regulated. So they can be contaminated with things like heavy metals or molds, pesticides. And that's where I really think it's important to educate the consumer that the FDA, by not regulating these products, really puts people at risk. The states are not equipped to regulate them from a health point of view. We do know that at much, much higher doses, so doses given to children with epilepsy, and just to put it in perspective, a 10-year-old child might take 600 milligrams of CBD a day. So that's a lot of CBD, and some of the side effects they saw were interactions with other drugs, so liver enzymes that might interact in metabolizing other drugs. But at the levels, at the doses given through these artisanal preparations, there are very little side effects from the CBD. And Dr. Hurd, you probably have more to add.
Yeah, Dr. Hurd, I was going to ask you about that, and another thing that folks in our audience is wondering. So and Dr. Jacobson, thank you. I think it's important to be clear that the risk profile of CBD is really quite low, but that's not an unequivocal endorsement of every product one might see on the shelf at a gas station or something like that. And definitely, consumer beware when it comes to that. Although of course regulation might give us the tools to better inform consumers. Do lab testing. Let us know what's in there. So, Dr. Hurd, I definitely am interested, on the THC side of things. What about that? I mean, what do we know at this point about addiction? How addictive it is. What the withdrawal symptoms may look like, and also just what sort of damage somebody might see over time from frequent use. And I know, and I'm sorry, Sarah. I'm seeing Sarah also, has obviously accumulated a lot of knowledge about this. So if either of you'd like to weigh in on that.
No, I mean, this is the issue why people come down on either the black or white side that cannabis is great or cannabis is, the devil's, um, you know, flower. And the aspect of cannabis that many people forget is that THC, the psychoactive component of cannabis, has changed over the years. So, even the 1990s, it was only about 4%. THC, and now you can have up to 20%. And the way in which a lot of young people in particular are consuming cannabis products with wax pens and dabbing, they can have 70% THC and more. And the higher the THC concentration, the greater the potential for addiction. So yes, you can become addicted to cannabis, and there's a clinical diagnosis of cannabis use disorder where people fulfill all of the criteria that would be fulfilled for other substances of abuse, for example, cocaine or heroin or alcohol. And we know that the past year users of cannabis, that about 30% of them actually develop a cannabis use disorder. So it's not that it is benign. And yes, there are individual risks or vulnerability, I might say, that whether or not someone might have a genetic risk, environmental risk, there are a number of reasons why someone may develop an addiction versus another person who next to them may have smoked the cannabis also in high school and didn't develop this. But we definitely see, and we know that, we can see the withdrawal symptoms like other drugs, for example. They have sleep problems, increased aggression, increased anxiety, even physiological effects of even sweating, in terms of, so it's both a psychological, which is still bringing, and some of the physical withdrawal signs that we definitely see in people with a cannabis use disorder. And I'll just add one other thing, that we do know that about 90% of adults with substance use disorders started in adolescence. And in the US, actually, the use of drugs have decreased in adolescence in recent years, except for cannabis. And a number of those individuals, about 25% of kids, have a cannabis use disorders. So that is, pretty shocking. But yes, you can actually become addicted to cannabis, and especially the high potency cannabis that's on the streets today.
Thanks for laying all that out. I appreciate it. And, frankly, as someone who reports on this has been one of those conversations where sometimes I almost feel disappointed in both sides of the legalization debate, where I hear from people who make very fantastical health claims about, marijuana and THC, almost as if it's a cure-all. And some, but not all, can be even, cavalier about use in at younger ages, which we should, the science shows us we really should be concerned about that. At the same time, certainly the reefer madness rhetoric is not accurate either. And we need to place these real risks, these real harms, in the context of the overwhelming sort of truth that's probably common sense to a lot of people who are up close with the plant, that the risk profile is relatively low. But let's focus on what the real dangers are, instead of the exaggerated ones. And Sarah, maybe you ran into some of that, sort of people shouting in both ears when you dove into this subject.
Well, one of the things that I was shocked at when I just tried to trace down the statistics, you would look at, deaths, 400,000 tobacco deaths, 90,000 deaths from drinking. Opioid overdoses were, in the 90,000 this year. Cocaine, 15,000. There were very few cannabis deaths, but at the same time, you can't really overdose from cannabis, but you can take too much. So you can end up in the ER if you take high potency cannabis with a short-term case of psychosis or even anxiety. So, I kept struggling with, should I say, for an adult brain, occasional use is safe. It seems to be safer than other drugs. But once again, it comes back to when you're using it, how much you're using it, what dose you're using.
And can I offer something?
Please.
What I would offer is I think it's really important for us to recognize how much criminalization has shaped our inability to have honest conversations about risk and about how we can actually give people more information so that people can make choices. Right now, because the sides are so polarized, because the science can get so politicized, because people are pushing an agenda, it's really hard for people to just find basic information like how much is too much. I can find that information for alcohol. I can find that information for tobacco. With the overdose crisis, we have even more information about opioids and heroin. We have that information for safer use for stimulants. But there's this conversation because folks on the side of prohibition are like, no use is good because it's a gateway. And then you have the folks that are supporting of legalization who are like, it will never hurt you, right? And for us, I think what's really important is that we want to give people information and we want to give people the ability to reduce the risk. Relatively low risk is not no risk, right? And I think it's important for us to be honest about that. And I think oftentimes we really struggle to have those conversations because this conversation is so emotionally charged on all sides of the issue, which impedes us from actually keeping Americans safe, right? Like we can't keep our kids safe if we are either putting our head in the sand or crying fire every 2 seconds. And that's what's one of the hardest things about navigating the cannabis conversation is how much this conversation is shaped by emotion and politics and racism and class. And it makes it difficult. And I think it also made it super difficult for parents who are trying to use cannabis to help their kids because they had to work through so much of that charge. And I think moms are
the superheroes of the world in multiple issues. And I think for this particular issue, mothers have been really important in really pushing through and getting people to see broader conversations.
You know, one thing I'd like to add is that cannabis impacts different people differently. And I loved, I couldn't fit the story into the film, but Raphael Mechoulam, the scientist who isolated THC, he took it home, the extract home to his wife, had her make a cake, invited his colleagues over, everyone ate it, and everyone had a different reaction. Someone said, I feel nothing but couldn't stop talking. Another person was laughing incessantly. Another person was staring off, looking at colors, and then one woman had a panic attack. And so, you know, you don't always know how you're going to react to cannabis.
Absolutely, and I hear that all the time from the people that I interview as well. And Kassandra, I just really appreciate you again bringing that nuance into this, because I think it's really important to give people clear-eyed advice about the actual risks, the actual things they should be prepared for. And I always try to do that for my readers here all the time, from perfectly sensible adults who the first time they try cannabis, they accept a brownie of unknown potency from their friend, scarf down the whole thing, decide that it's not working, and then finish the rest of the plate because they're hungry. And we all know how that ends, sometimes maybe in low Earth orbit. But having that information about how things might affect you and being prepared for that is critical. So I appreciate folks like both of you bringing that good information to the public. I love this question. I think someone in the audience may be gunning for my job here. This is sort of a crossover between the equity side of our conversation and the science side of our conversation. This person is a researcher and is wondering what they can do to help advance equity in the context of cannabis regulation and policy. And is there any way for researchers to contribute? And I would also ask, what for our folks on the science side of the divide, what is your obligation to equity? How does it inform your work at all? Do you have that racist history of the drug war in mind as you set about an experiment? So I wonder about that. Maybe Kassandra, you could just start us off quickly on what you would like to see from researchers from your chair, and then maybe we can ask our science folks to come back.
So I think there's a science to criminalization and the harms that it's happening on communities that I think is often not elevated. I think oftentimes people look at the science associated with different substances or different kinds of behaviors, and the science associated with criminalization, surveillance, and punishment, and the physiological and mental impacts that are happening to communities, and the ways that these harms are also impeding people from being full participants in our society is something that needs to be elevated. I think oftentimes research or stories show the trauma and the pain in sometimes exploitative ways, but is not often connected to the ways that there is research or studies behind it. So I think there's a need for building the science around criminalization, because I think that is inequitable when we're having these conversations. So folks talk about the brain science associated with cannabis, but not the brain science of walking through an armed block when you're going to get a piece of pizza, right? I also think that there's a conversation about what are the different kinds of market options that we have. Currently with cannabis, we are in a regular capitalist market, and that's really scary. And it's really scary because we are taking a substance like cannabis and putting it in the bottom line is profit. And when the bottom line is profit on a vice, health goes out the window. And so I think, and when health goes out the window, some communities are disproportionately impacted by that because they don't have the same infrastructure to support them when they're being targeted through exploitation. And so I think there's a real need for research around what are different kinds of market schemes that we can offer that are not based in the traditional way. I think if we look at the role that capitalism has played in pain management, you see that with the overdose crisis and the Sacklers and the legal system that basically let them get off scotch-free. And that's what happens when we commercialize healthcare, right? And so I think that is a thing that is super important. And I would suggest people look into centers like the Parabola Center that's run by folks like Shailene Title, who's doing research on how we can create research-based inequity through regulation and policies. Folks are finally having that question, and I think that's a great opportunity for researchers.
I think you're very right to point out that criminalization and its effects itself is a subject that is ripe for science and research and real deep study. So what about that, Dr. Hurd, Dr. Jacobson? Any thoughts? Coming from the science community, how does this history inform your work? If it does, how do you think about that?
Well, I mean, for me, I will say that I think science is similar to scientists are similar to everybody in society, and you're impacted in some way with how a particular drug may be viewed in our society. But at the end of the day, the results are the results. And that's what we say. And, my team, we talk about that all the time. Whether or not you might get that result published, if it may be a negative result, is another thing, So, if does cannabis always have a negative impact on the brain or behavior? No, but it definitely, not on every single thing that's studied. Can you get some of those negative results published? Like I said, it sometimes can be difficult. However, I will say many people think that, oh, we are paid to find negative things about drugs. That's not really true. I can tell you that when when I wrote my grants on cannabis, it was tough to get research funding, because people would say, other scientists, oh, cannabis, I smoked it in college, it's fine. I don't think this is, anything bad. We should all be looking at cocaine. You should go study that. And, and when I studied the developing brain, it was, why are you studying the developing brain? You should study it in adults, and so I think that we all come with certain biases. However, it is really important, and research is expanding on this in the sense of making sure that when we do research, especially in human populations, that we're studying everyone, that represents all communities. Often in research, you would have only certain groups of people who were represented in research. And I think that we now have research being done, really elegant research being done on aspects of stigma and racism. And people with a substance use disorder have, a triple whammy of a lot of the stigma that goes along. And when we talk about, the criminalization, the war on drugs, that has destroyed a lot of communities, that has also huge impact on the developing brain, huge impact. So I think that, for science, we need to make sure that we do cover all aspects of our research and do so in an unbiased manner, where the results are the results, and that journals will accept our results, whether or not they may be negative, or show that something may be good or something may be bad. And that, I think, would help a lot.
Well, we definitely appreciate the commitment of folks like you to follow the truth and follow the research wherever it leads you, because that's, I think, really what leaves us in the public in the best place. Dr. Jacobson, I wonder, I couldn't help but think when I heard you tell your very poignant story in this film that while you have, been able to find find in family, there are so many kids out there who probably would benefit, from CBD, but because of its legal status, because of where they live, they may not have access to it. That strikes me as an equity issue, and I wonder what you see as the future. What is sort of the next fight in terms of expanding access, and fully realizing the medical benefits of CBD? Maybe you could lay out that road ahead for us a little bit.
Well, so I chose, because of the difficulty of finding not just CBD at the time that I started, but any kind of safe cannabis preparation for my child who has a very brain. I chose to go the route of developing or initiating the development of a pharmaceutical drug product, which is very different than any preparation you consider for medical purposes in the market right now. And you're right that not everybody had access. So I was very lucky in that I had the resources to go hunt down CBD enriched cannabis, find it. I had friends who were chemists who helped me figure out how to extract it and purify it. But one of the reasons I wanted a prescribable, prescription medicine was so that every child had access. So it can be given by prescription. So every child in the US has access. And in fact, as I was doing this work, I considered it a human right to have access to CBD because it could be a potentially life-saving medicine. And again, it's not going to help everybody, but they deserve the right to try it. And I feel strongly that we should all be pushing for CBD to be on the WHO list of essential medicines so that children all over the world have access to it. Children in developing countries have access to very few anti-seizure drugs, and there's no reason why CBD shouldn't be one of them. It's a generic compound, right? It's not a proprietary compound, and so as I went through this and I encountered all of the obstacles I encountered, I really began to think of it as a human rights issue.
I think that's a really important framing to bring to this. Thank you, Dr. Jacobson. And I think it's very interesting to think of this issue going to the international level even. And that really expands our frame when we think about equity. So maybe we'll have to send Sarah and her crew, get them on a plane, and we can have a follow-up and get some reporting from the rest of the world on cannabis.
I have to say one more thing,
Sure,
because you
please.
asked about the road ahead, and
Please do.
unfortunately, nobody's going to do the research and develop a medicine unless there's a return on their investment. And somehow, for this particular one, with the company that developed it, there was a return on investment, worked out. But it's a shame that we aren't going to see as much research as we should on CBD for other indications, because drug development is a profit-driven industry.
I mean,
Absolutely. Please go ahead.
no, there are a number of companies that are, there are now many companies that are developing CBD because they're trying to run to that CBD gold rush, because they do think, and perhaps, Epidiolex is the only CBD product that has FDA approval for the treatment of the two rare forms of childhood epilepsy. But there are companies that sees CBD as the panacea to enrich their bottom line, and so there are some clinical studies being done on other disorders for our group. For example, studying opioid use disorder. There are others studying anxiety disorders in adults, and there are a few studies that are going to start soon in teens. And there are pilot studies being done for different forms of cancer, but there is nothing really, the amount of investment that perhaps that first company made, the other companies are not going to put as much. They're wanting to get back their return very much by leveraging the fact that CBD is now very popular in our society. But really, and I can't emphasize this enough, medicine requires rigorous clinical trials so that we understand who it can help, we understand the doses that are beneficial, and we know side effects. Every medicine that you take, your doctor will tell you, this is when you take it, this is perhaps a side effect that you can expect. This is critical. And so I feel that many companies who are not even perhaps even supporting clinical trials, but just on the website, and because I understand it, a lot of families are desperate, and so they will buy CBD products from these companies. And as Dr. Jacobson said earlier, there are so many things in these products other than CBD. So that's another reason why it's critical for us to develop medicine. And I do believe that we can develop cannabinoid medicines the right way, and so that physicians can actually help so many people in need. We are a society based on evidence-based medicine, so let's have the evidence.
Thank you. And I think that actually leads us to something very important, and it's something that folks in our audience are definitely asking about. They've got different medical situations in their lives. I'm hearing from someone who has whose mom has uh, pancreatic cancer and is wondering, what the state of the research is there. Someone else is wondering about where they go to get access to cannabis for a severely ill child. So where should our viewers turn for good information when they are in one of these situations where it's either themselves or someone in their family is sick, is looking for medicine, wants to know what's helpful, what's not? Where should they turn? Because clearly there's a lot of not good or self-interested kind of profit motivated information out there. We don't want to steer people toward those sources of information. So I would actually throw this out to anyone. What do you think about that? Where should these folks with these types of questions turn?
I mean, I feel pretty strongly that they should turn to their doctor, because in the end, it's a risk benefit analysis. And hopefully the doctor will discuss it with them in an open-minded way. Now, as a panel, we've all discussed that that's not always the case. And so if your doctor will not discuss it with you, then you find another who will discuss it with you. It's a reasonable question, and doctors should by now have an answer. When I was working at the last company I worked at, I got emails from all over the world from patients who wanted access to cannabis products for medical purposes, and the stories are heartbreaking. But we don't have the data to support the use of these products in treating cancer. We only have the data to support their use in ameliorating the side effects of chemotherapy or end-of-life care, for example. So we do want to dispel the myth very strongly that cannabis products can in any way cure cancer. And if you have a severely ill child, it's a risk-benefit analysis, right? So I have a child who's very sick, and I will take risks in order to treat him that I would not take with my very healthy child. And I hope that makes sense to everybody.
Absolutely. I think that kind of nuanced risk-benefit analysis is exactly what's needed, because these are complex situations, and definitely bringing in expertise, like you said, turning to a physician is vital. But again, not every physician is educated about this. There may even be some jurisdictions where asking a doctor about obtaining cannabis for a minor could prompt that doctor to have concerns about how the child's being cared for, which may not even be warranted. It could just be a desperate parent really trying to help a very sick kid, but still. So yeah, anyone else on that about the sources of information, or maybe that situation we just discussed?
One
thing I would suggest would be for people to kind of scan for the clinical trials that are underway. Like there's a clinical trial right now at the University of San Diego for using CBD to treat children with severe autism. But when I was trying to hunt for stories to cover in the film, I began to scan through the clinical trials that were going on across the country. And I could see trials for autism, for PTSD, for just a range of medical conditions. And so that might be one way someone can get access to medical care and find out if cannabis could be useful.
Yeah, I was going to.
Hey, please go ahead, Dr. Hurd, and then I have one for Kassandra.
Yeah, I was going to say the same thing, Sarah. It's really critical that people realize that they can empower their own access to research, and clinicaltrials.gov is the site. So, but it also brings something, Dan, that you said in terms of, that parent in that state where the physician either is not knowledgeable or, is completely anti. And when you are so, as we said before, black, white and everything, then you put people at peril, because then people think, oh, they go and find bad products somewhere else. But it brings up the point that it shouldn't be statewide. We need federal knowledge. We need a federal databases. We need the federal government to make this a federal, that it's that everyone can talk about this with physicians throughout the country. It shouldn't be illegal in that way, so that physicians can be educated about cannabis. the fact that there is not a lot of research done, so that they make sure that for those physicians who say, oh yes, it's completely fine, when there really isn't the data there, and also for those physicians who say, it's horrible when the patient, that may be one of the last things that they're trying because they are desperate. So the National Institutes of Health is obviously our national federal organization that sponsors a lot of the clinical trials. And so I think it's also important that they work to have websites also more accessible to the public, so they can have knowledge as to what treatments have been conducted or in progress, that could also link to clinicaltrials.gov across all the institutes at the NIH.
Right, and thank you. That's a great answer and a great example of one of those areas where prohibition is maybe holding us back from something that almost just seems like common sense, like the government giving people the realistic information, showing them the trials, telling them about the real risks and stuff. But the commitment to the absolute prohibition sort of gets in the way of that type of communication, and it makes it harder for the folks in our audience who are asking so many of these kinds of questions, who are just looking for honest answers. It frustrates me as a reporter. Now, I want to sort of flip this to the other side, but a similar question for Kassandra. Folks are wondering, just like we have people in the audience wondering, where do I go for good information, about the medical side of it? Where do people go for good information about the advocacy side of things? So someone is writing to us from New York, which of course just legalized cannabis. They're concerned that the promises of social equity made in that new legalization law there in New York may not be implemented fully, or not in a way that they would like to see. So how can people get involved? Where should people turn for information if they are feeling passionate about changing policy and getting involved in that and writing regulations?
I think Dr. Hurd, I can't remember if it's in the film or in some of the calls that we've had. The thing about cannabis is that we're here because people pushed us to get here. The population is going faster than the science, and it's going faster than the decision makers. And in the place of New York where, I worked on that bill, they have open meeting laws. And so they had their first meeting yesterday, and they just appointed their chief equity officer was just put into place. The regulations have not been written, but they have to do meetings. And so I think there are multiple groups, CanAware, CanOcclusive, Start Smart Coalition, that are in New York that are working towards this. The Hood Incubator is another national organization that has statewide chapters where people are pushing on issues of cannabis equity. There's other organizations like Women Grow, which have chapters all around that really look to make sure there's gender equity in the way that the business is set up. And so I think part of the conversation is, who has made the decisions? If cannabis is now regulated in your state, can you find out when are the meetings and show up? I think a great example of that has been Massachusetts, where there's been a lot of public comment and a lot of public advocacy as regulations, as things are being put forward. The thing about policy, I believe that policy is a last resort, because I believe that if communities tell you what they need, if we have to pass a bill for people to be respected, for people to get resources, we've already lost a bit. So policy is our last resort. We do it. And then implementation really comes back to how many people are still paying attention. And so I think it's really critical for people that are interested in equity issues to join the meetings and push forward. There are a lot of people that are very passionate about this issue. There are tons of groups, and folks should plug into that. I think people should be paying attention to when people are able to enter into the market, what kind of resources and capital are given to people that have less access to capital. I think people should be paying attention to the role that multi-state operators can play in this space. I think we should be paying attention to how larger companies like alcohol and tobacco companies are playing in our state legislature, and figuring out how we can make sure that people have access to different kinds of licenses. People looking at vertical integration, which is basically like you have to do seed to sale. And that often takes a lot of capital, or the ways that they're setting up the regulation of how you can get a license and how much stuff you actually need, the licensing fees, and figure out if there are ways that you can create different point systems based on your connection to the drug war and how it's impacted you. I think there are a ton of things that people can look at, but cannabis is an issue of direct democracy. And as we all know, considering on January 6th, democracy is not something to be taken for granted. And people have to pay attention and remain engaged.
Thank you. That was really comprehensive. I appreciate that, and so thank you for mentioning those organizations and those policies that folks should be looking for. Certainly agree with your observation about the Massachusetts community. They're very active. Just ask my inbox. It's full of missives from our very engaged advocacy community, which I actually really appreciate, and they've had a huge impact on policy in Massachusetts. Recently had a legal challenge to inequity policy that was dropped because a group of people who were really passionate about that equity piece of thing came together and started convincing companies to drop their support for this lawsuit, and it worked. And I also really appreciate your observation that beyond the legal regulations, beyond the mechanics of the law, we've already lost in a way if we're writing policies to fix these situations. And I hope our conversation, I hope this film, I hope the good reporting that is now finally being done on cannabis, I hope all of that helps people have better informed conversations, some of those more like private one-on-one conversations that maybe aren't about tangible policy, but help improve the discourse and improve the atmosphere and improve the extent to which this whole conversation is based on facts instead of assumptions and old narratives and things that we just sort of picked up from the environment. So we are actually now coming to the end, unfortunately, of our panel. I feel like we could talk all night. I did just want to give each of our panelists just a moment to offer us any closing thoughts they have as we wrap up the conversation. Sarah, why don't we throw it back to you to start off with?
Well, I just think one of the things that amazed me in doing this film was the discovery that we make our own cannabis-like molecules, and they form a regulatory system in our body that oversees key processes like appetite, mood, cognition, memory. And so when we use cannabis, we are engaging that system. And I just hope that viewers would come away with an appreciation of how powerful this system is, and understanding that cannabis is not necessarily a benign drug. You are engaging a key system whose sole purpose is to keep your body in balance.
Thanks. Dr. Jacobson?
So I guess my closing remarks would be, just because this was the main problem that I ran into, is that we really need to push for federal regulation of these products, because what's on the market right now is not safe, because of the increasing THC content that we're seeing, but also because of all of the contaminants that can be present in these artisanal preparations. And I really, I don't know what the solution is for people who are looking for medical cannabis preparations when they're really sick. I wish there were a better solution. I would say find a doctor that will talk to you and help you. Find a purveyor of a cannabis product that you can trust. Ask a lot of questions and just try to find the safest product possible.
Thank you, Dr. Jacobson. Appreciate it. Kassandra?
I would say that criminalization cannot be the way that we view substances. We know that criminalization makes everything more difficult. It makes it harder for us to actually get research. It makes it harder for us to give people education if they choose to use drugs. And so as we move into this next space, I think this conversation around the cannabis question is super complex. I think there are people that are watching that would think conversations about other drugs, be it the heroin question, the LSD question, or other substances, folks might think that the issue is a lot less complex. And what I would offer is that it might not be, and that we should recognize the way that viewing substances through criminalization is impeding us from having the real nuanced and complex conversations that are necessary for us to navigate complex human behavior and the choices that people make. And so I really hope that people take this opportunity with this film and listen to the complexities and the nuances and really think in broad space and in a broader way about how we look at drugs in general and figure out how we can have this kind of conversation, this kind of research to really look at drugs in general and recognize that criminalization, if criminalization is bad for cannabis, it's bad for other substances as well. And we should figure out an alternative response to moving forward.
Thank you, Kassandra, and I really appreciate your admonishment to sort of extend this exact type of critical thinking, this lens, to other issues, including the legal status of other drugs, which is really becoming, in a way that it hasn't in a long time, a live political issue. We can just look, for example, at Oregon, which just passed a statewide decriminalization initiative. So this is not an abstract issue, and I really appreciate you, directing our attention to that coming conversation for many of us. Dr. Hurd, why don't you give us your final thoughts, please?
For me, I think in terms of, the panelists are amazing. I've gotten to know these ladies over Sarah's journey here in making a really great and important documentary. So I'll start with Kassandra in part. I completely agree. Criminalization also has hurt research. It's actually hurt the development of medicine. It's actually also hurt us being able to give concrete information to the public and physicians about the good, the bad, and the ugly. But one of the things this is important for people to understand, this is nearly one of the first time in history that medicine was voted on. Therefore, it's not medicine. When we call it medical cannabis or medical marijuana, it is not. We need research to make it that. So we're hurting people by not really having the research done, so people won't have to go and buy bad CBD products, bad cannabis products, that they can actually get federal cannabis products or FDA approved products that they can use and know that it's safe for their loved ones. And that to me has been the problem. So with substance use disorders in general, that we have stigmatized it, we have criminalized it, so that we have not been able to help the people who need it. People have a disorder when they develop an addiction. Just like every other disorder, they deserve the right to have treatment to help them get their lives back. And we have now cannabis at concentrations of THC that are unregulated, where we have a lot more pregnant women consuming cannabis products, and we know the impact on the developing brain. And it's not that cannabis replaces our endogenous cannabinoid system. It actually overwhelms it because it's at concentrations that completely, it's like a hammer on our endogenous cannabinoids. So we completely are killing our endogenous system. And we know that the teenage brain is definitely vulnerable, and especially for certain, obviously, people who have certain risk factors. So for me, I want the public to be more educated. I want the public to be involved in research. I want the public to force their government officials and bring Kassandra's more involved with the research enterprise, because that's how we had decided we wanted to live and develop a society where we evolve and improve medicine and healthcare together, and everybody should have access to it, not just a few. And we should know that drugs can hurt certain people, and we need to help them too. They shouldn't be pushed to the side. They shouldn't be put in prison. They should be helped through medicine.
Thank you so much. I think that's actually a great place to leave us. And as I listen to you folks talk about this and the path forward, the biggest thing I think is I just hope that it is people like you who are at the table when these things are decided, because I really just appreciate that each of you has taken a sincere and earnest look at this issue. You're willing to acknowledge the nuances of it. You're willing to acknowledge both the risks and the benefits. And I think that we all in the public benefit when the conversation is nuanced like that. So thank you, and please continue in your work. So thank you to all our panelists for being here, for expanding on the film, for sharing all that expertise with us. It was really invaluable. And I'd also like to thank everyone in the audience. You folks submitted absolutely great questions that really stimulated our conversation. So thank you for doing that. We're grateful that you were here, and we hope you found this educational and enjoyable. And I'm sorry that we couldn't get to every question. Also wanted to let everybody know that if you are looking for more Nova cannabis content, you can take a deeper dive into what science can tell us about the therapeutic potential, risks, and long-term effects of cannabis on the body and on the brain. And that's all in the most recent episode of the Nova Now podcast, which is available on Apple Podcasts and Spotify. And don't forget, if you haven't already seen it, or if you want to take a second pass now that you've listened to our conversation, the Cannabis Question is available to stream. It's free, and it's on Nova's website. It's on Nova's YouTube channel or on the PBS video app. And that is all we have for you this evening. So thank you again to everyone for joining us, and we wish you well. Good evening.